Hi guys, welcome back to my channel. My name is Dr. Assistant, and today we have with us newly qualified Dr. Kentino Nwanko, who is now a UWI graduate. He graduated this year from the Faculty of Dentistry. He is now a newly qualified dentist. Welcome, Kentino. Let's tell us a bit about yourself.
Well, like Dr. Assistant said, I'm Kentino Nwanko from the Bahamas.
Yeah.
Why you talking Nigerian descent.
Boop boop.
And I'm 33 years old.
Boop boop. Again.
I did my first degree in the US at HBCU in Florida.
What's the name of it?
Florida Memorial University.
Okay.
I did a Bachelor's of Science in Biology and I minored in Psychology. I graduated in 2014. And then I decided to attend UWI because I was always fascinated with Jamaican culture. And my government also was willing to sponsor me for tuition, so it was like two good reasons
to pursue.
Yeah.
I mean, you were telling me before that you really like dentistry, and you said that was as a result of your childhood experience with dentists.
Yeah, when I was, as far as I can remember, age 5 or 6, I was really young, and I remember my dentist, who was my mentor, gonna be my boss pretty soon. I don't know, for some reason he just made the environment so good. Made me want to stay there. You know, kids usually afraid of going to the dentist, afraid of seeing all these things coming towards them. And I was always excited to be there. And I said, this is something I would want to do for the rest of my life.
So what are your favorite aspects of dentistry?
My favorite part of dentistry would be surgery and periodontology, periodontal disease.
Fun fact.
Yeah.
Kentino, myself, and 3 other males were in the class of 2020, and of the 5 boys in that class, 4 of us wanted to be oral surgeons. So Kentino is actually an aspiring oral surgeon. That's one of the reasons why I wanted to interview him, as well as today is his last day in Jamaica. Last day. He's heading back to Bahamas, as he said, to work with his mentor and some other specialists in that area to, further his curriculum vitae, as it were, his career. So here's the thing. We're going to go a little bit in depth as to his experience at the University of the West Indies here. So first question, what are some of the pros of University of the West Indies mono-campus dental faculty? Some of the pros, some of the things that you will never leave your mind. Yeah.
I think the pros would be the medical aspect of the program, being able to know or have so much knowledge of medicine when you compare the dental schools around the world. They don't have much information regarding medicine aspects, so you'll be able to communicate with patients and try to help patients with their medical conditions.
Okay.
And you will probably know what the patient help by just looking at the medication list.
Okay.
So I think those things are very important.
So that's one. Anything else? Talk up louder because I don't know the microphone gonna hear.
Probably being able to communicate with the deaf community. I think that was different. It's very unique.
Yeah, to learn sign language.
Yeah, to the other dental schools, I guess it was very unique. So I think that's something I can take with me. Although the sign language in the Bahamas is a bit different.
Yeah.
But it's still a start. So I think that was another plus for me. And also being able to connect with other dentists from around the world. So like in the US, in the UK, and even here in Jamaica, a lot of dentists train elsewhere and they have connections in other places that allowed me and my other classmates to do an externship in New York City.
Mm-hmm.
So I think having those connections was also a plus.
So what are some of the cons?
From the cons,
Like a smile.
I think one would be not having clinical exposure early on in the program, like at least second year, and not having some clinical base application in each dental course. I think that would be a plus for students moving forward in the program. It would help them develop the clinical knowledge before actually seeing a patient.
Okay. So, what are your future plans now that you've graduated from the Faculty of Dentistry? And do you plan to come back to practice in Jamaica at any point in time?
I would like to have some connection with a practice here. I'm not sure how is that going to work. Okay, that's a plan. But I want to, like we said, I want to further my knowledge into oral surgery. So I want to go either UK or the US. In terms of the UK, I want to do either a master's program or do MBBS here and then go to UK and further training. Or I want to go to US, probably Harvard University oral surgery program or hospital in New York City. And I would also like to travel and work. So like travel different countries, especially in Nigeria, and be able to give back to my people, but our people.
Well, technically, I am Barbadian, 100% Barbadian.
Okay, 50%.
100%. He's half and half. So, one of the things that we do here, we actually do American board exams. We do the ADEX exam as our licensing exam. This is something that happened in the last 10 years. Kentino has passed his ADEX exam. I haven't even started yet. But how do you compare the ADEX exam to your final Doctor of Dental Surgery examination, which was the exiting exam for the University of West Indies? How did you find it in terms of difficulty when you compare the two exams?
Well, the good thing is that with UWI, the UWI prepares you for the ADEX exam because in your final year you have to pass quality assurance exams and a lot of clinical exams prior to taking your final DDS.
A lot.
So I think doing those things repeatedly help me personally, especially the restorative part and the fixed posture. So, but endo as well too, because I did not do much posterior endo on a patient, and that was a part of the exam, and thankfully I was able to pass that just by practicing on a typewriter. The perio aspect was pretty nice. The restorative part, the ADEX exam was a bit long and it's very nerve-wracking. And you probably have to get a good night rest and practice a lot and get a tactile feel of how the tooth is, how caries would feel, and how it look, because that would determine whether you pass or fail.
Okay.
The fixed posture is very technique sensitive. I feel like doing that, you have to practice as much as you could prior to taking that exam. The written aspect, you have a written aspect where they just pretty much ask you like case-based questions and you have to like answer MCQs based on the case.
Oh, it's not essays. Okay.
So that was pretty good as long as you study the NBDE books or first aid books.
You should be good.
You should be good.
Okay.
Yeah. I think as long as you practice and study that book, you should be able to pass.
So that's for the ADEX exam.
That's for the ADEX exam.
For the final DDS exam, though, you have to read.
Yeah, final DDS for me, I was studying from probably January last year, intermittently, like off and on. And I had a long time because I had financial issues, like most people.
Like myself too.
I couldn't take the exam with my other classmates initially, so I had to wait a longer time. So that prolong the whole study period for me. So it was really hectic for me, and I got annoyed at some point, but I kept studying because I knew what I wanted, and that was to get out of UWI and start my career. So yeah, I would say just keep studying, find people to study with, at least 2 people, and look up cases online. Whatever topic you do, type it up online on Google, and trust me, it helped me so much.
So case-based learning is best.
Yes, don't just read the book, the textbook. Have to find ways to apply the knowledge, or see how others apply the knowledge, and it helps you when it's coming to final DDS or even OSCEs. So you have to pass those 2 independently to pass the exam overall. So yeah.
So you've heard it from this newly graduated dentist, Dr. Kentino Nwankwo Chukwuemeka. Chukwuemeka.
Yeah.
From the Bahamas by way of Nigeria.
Yep.
We've been friends from 2017. It's been a rough time in dentistry, when I tell you.
Yeah.
We've had experiences where, like, most of the class they didn't pass a course, and we had to do a lot of remedial work. It was rough. Most persons who have been to university lessons know that the pass rate is, you have to pass, and to do really, really, really well, you have to really, 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 really put in the work.
Yeah.
So it's been an honor. I want to wish you a safe flight back to Bahamas. And hopefully next year, or at some point in time, we'll link back up when we're both studying oral and maxillofacial surgery.
Yes,
I'm hoping Cecil, who is also in our class, and Ting as well, they want to pursue oral and maxillofacial surgery. So at some point in time, we all link back up, because we originally were the class of 2020. So things happen, and COVID hit, and financial issues hit. So Kentino, we know that you want to big up your dad.
Yes.
And your family, and just like my mom is the biggest part of my life, and my family, my sister, my brother, my friends, Ronaldo, Andy, well, Dr. Batiste is upstairs, you name it, Tricia, you big up your family, bro.
Yes, I want to thank God, first off.
That too, of course.
He's been constant guidance, held my hand the entire journey, never left my side, so I just want to thank him. Thank my dad. When I got very overwhelmed and emotional, he's always there to calm me down. I don't know how you do it, but he just do it. And he's not here physically, but just hearing his voice sometimes brings my nerve down. I also want to thank my friends, especially Dr. Sasha Oliver,
I don't know who that is.
My mentor, Dr. Von Conliffe, Dr. Lawson Myers.
I know who that is.
Dr. Clark.
Yeah, man. Dr. Clark.
I also want to thank University of the West Indies for giving me this opportunity to pursue my dream and now live it. And Dr. Cisnet for interviewing me. So, yeah.
Ladies and gentlemen, it's been an honor. Dr. Nwankwo, freshly graduated from the Faculty of Dentistry. It has been a journey, let me tell you. Ladies and gentlemen, keep subscribing, keep following.